Once you are done asking your question, please mute yourself and turn your video back off. And any follow-up questions that are not able to be answered at this time, I will follow up with you and we will get you answers as much as possible. So without further ado, I will turn this over to Commissioner Baker.
Thank you. Thank you, Rachel. Good afternoon, everyone. Thank you for joining us this late afternoon press conference. We do apologize for making it 4 o'clock in the afternoon, but this is the absolute best we could do today. And we did not want to wait another day to release the information that we're releasing to the media today. You all should have gotten a press release just prior to the press conference. And the purpose today is to announce updates of testing in Mississippi, Vermont, and the identification of another positive inmate in Vermont. And I want to go over each one of those scenarios. We have received test results from the testing of the Tallahatchie County Correctional Facility in Tennessee, operated by Core Civic under a contract with us. At this point in time, we've confirmed there's 147 Vermont inmates who have tested positive for COVID-19. There's 62 inmates that have tested negative, 8 have refused, and we're still waiting for 2 tests to come back. We did testing yesterday at Northern States in Newport, and those results are back. We did a testing of 370 inmates and 140 staff. 1 inmate tested positive, which I'll get back to in a minute. That positive inmate had been in quarantine, and the rest of the facility tested negative, to include all of the staff. The individual, and I can't give you much more information in this because of privacy, that individual had been at Northwest during the time that we had the outbreak in April. It was one of the individuals that tested positive. Their test has been going positive, negative for a period of time, and the health department is not planning to count that test yesterday as a positive test because of the history of the inmate. We're going to follow our protocol as if the individual is positive and keep that individual in medical isolation to be safe and to protect the facility in Northern States. We had another positive inmate in Marble Valley Correctional Center this week. That inmate was brought into the facility and quarantined. And during the quarantine, we followed our protocol of testing days 0, 7, and 12. And that individual came back positive. That individual had not been in the general population, had been in quarantine upon entry into our system. Our emergency response team, which is a partnership between the Vermont Department of Corrections and the Vermont Department of Health, immediately did contact tracing and investigation, and we identified all of our staff that had contact with that particular inmate, and those staff members have been tested. They are currently quarantined away from the facility, and we're waiting the results of their testing. So at this time, I want to just say that as the Commissioner of Corrections, I am very concerned about the test results coming back from Mississippi. We are sending eyes on the ground to Mississippi tomorrow. Our medical director is going there, is going to be checking on medical operations to assure us that the quality of care that is going to be provided if there is an incident with any of the inmates that are positive is the standard that we expect from Core Civic. At this time, there are no inmates that are exhibiting any symptoms that are concerning us. We will validate that by tomorrow afternoon when our medical director gets on the ground in Mississippi. We're also sending down our facilities and operation chief in order to check on protocols and processes that are being followed at the facility in Mississippi in order to report back to us and validate what we're being told by Core Civic. At this time, I'm going to open it up to questions and try to answer your questions the best I can based on the information we have right now. Rachel, I'll let you monitor and manage the questions.
Yes, sir. First up, we have the County Courier.
I guess my first question would be,
Can I ask who I'm talking to? I know it's not, pardon me.
I guess my first question would be, why is it taking till Thursday to get somebody on the ground from Vermont? You were aware of this, I think, on Saturday or Sunday, if not before. How come we weren't able to get someone there sooner?
Because we're working out the details of identifying the staff that would go down. And quite candidly, we're asking staff to do this in a high-risk area. And we had to make sure that medical protocols were being followed. We had the right equipment. They could travel. We had an itinerary put together to determine what we need to know. And that took some time for us in our interaction with Core Civic to really start to figure out what was going on in Mississippi to build the itinerary that they'll be following when they get on the ground.
All right, thank you. I think that's it for me.
Thank you. It would be helpful if folks, I know you're identifying, Rachel, they're identifying their outlet, but it'd be helpful if I know their name, please.
Yes, this did come from the general email for County Courier. So who was that with the question?
Yeah, sorry, that was Greg Lamori from the County Courier. I'll identify myself better next time. Thank you.
No worries. Thank you, Greg.
Thank you very much.
All right. Next on our list, we have Eric from the Times-Argus / Rutland Herald.
Good afternoon, Eric.
Good afternoon. So this inmate in Vermont, I was a little unclear. So this person was tested before and they still have the virus? How long have they had the virus now?
You're talking about the individual that's at Northern State, since we're talking about 3 separate facilities, correct?
Yes.
You're talking about, okay. So we have had experience, Eric, and the health department has had experience with situations where people will test positive, they'll test negative, and it'll go back and forth. There is a window based on our guidance from Vermont Department of Health of 90 days that someone could in fact test positive in that 90-day period. This is a very unusual set of circumstances, and the health department believes that there are the possibility for false negatives coming back, and that they feel strongly that this individual is not a danger to anybody else. But we are going to keep them in quarantine for the 14 days that we normally, isolation for the period of time that we normally isolate somebody.
So this person is somebody who has already tested positive. They've already been counted as an additional case.
That's correct. They tested positive prior and then tested negative and now tested positive. And that's not unusual. Yeah, it's not unusual in this testing process.
Right. And the whole time they've been quarantined or separated anyway, so they're not a threat.
That's correct. And asymptomatic. And asymptomatic.
Okay. Thank you, Eric. Next, we have Adam from the Appeal. Adam.
Good afternoon.
Hi, good
Adam.
afternoon. My question is, have any of the people who have tested positive as part of the Vermont population at TCCF, did any of them work in other wings of the facility?
We are doing contact tracing. We have established a pretty significant communication process between our staff, Core Civic, the Vermont Department of Health, and the Mississippi Department of Health. we're doing contact tracing now to determine that and identify if people have had contact. One of the questions obviously here is the size of the spread, trying to identify the course of how that spread occurred. And so I don't have a definite answer right now, but that's part of our investigation as part of our contact tracing.
Okay, thank you. And by when do you imagine that you'll have an answer to the question of how far the spread was able to propagate within the facility?
Again, we are working with Core Civic and we're requesting certain things from them. The first request we had at the end of last week was we demanded that all our inmates be tested. That was totally outside not only protocols they had, but what the state of Mississippi did. And we were insistent on that. And the next step was testing their staff, which is ongoing right now. The way the setup is there, the Vermont inmates are housed in an area that's away from other housing of inmates. But that does not mean that a Vermont inmate could not end up in another part because of a job assignment or something along those lines. We are in the process of trying to determine that now, and I don't have a time frame. Part of the reason for us to get boots on the ground in Mississippi tomorrow.
Great, thank you.
You're welcome.
Next, we have Mike, the Islander.
Mike Donahue, how are you, Mike?
Thank you, Commissioner. Good to hear from you.
It's good to hear you, Mike.
Two things. One, any thoughts on reopening St. John's Ferry as you did when you had the problem in St. Albans?
Nothing is off the table, Mike. I consider this a full-fledged serious emergency. We're managing that way. Our conversations are starting early in the morning, going into late at night. We need to get our medical folks on the ground down there. So I have a level of confidence as a commissioner. Number one, that the folks that were responsible for there are getting the care they need. And number two, to make sure that what we're being told about no one having symptoms we should worry about is factual. And once we have that information, if we think we need to move folks, that'll be part of our ongoing emergency management of the situation daily. And, we talked about a couple scenarios that we could potentially make work, but none of them are going to be easy. So I'm not saying it's off the table and I'm not saying it's on the table, but I'm saying everything's under consideration.
And just one other thing, going back to the first group that tested positive when they arrived at Marble Valley, I'd seen inconsistent reports. The transport I heard was described at one point as a van. Later, I think the governor or somebody called it a bus. I mean, what is it? I mean, how many seat vehicle is this thing, and how many people were actually in the vehicle?
I don't actually know the size of the vehicle, Mike. I do know that the vehicle was equipped with a bathroom, for example. So the folks while being transported did not have to leave it. We did contact tracing with the staff members that were on there. It's a separate company that does the transportation. And so when you ask me if it's a bus or a van, I think the best description is it's some type of bus that had the accommodations for a bathroom on it. And I'm not completely sure, what the size of it was, but my understanding is the only inmates that were on that vehicle with the staff were the 6 inmates that were being returned to Vermont.
And the staff that were there, how many members are those guards or just drivers, or what is their, how many are there and what are their jobs?
I don't know what their title is, but I believe there was 4 of them so they could rotate off driving. And we immediately notified the company that provides that as part of our contact tracing. with our emergency response team, and they've been identified, and I believe they're being tested. I don't know their status at this point.
Okay, just to be clear, there's a company that is not Department of Corrections employees driving this thing, but there were also guards or some Department of Corrections personnel there.
Vermont Department of Correction, Mike?
That there were some Vermont Department of Correction employees actually
no, there were not.
No, there weren't. Okay.
No, there were not.
They were all this company that does private transport for you guys.
The contractor, correct.
Yeah, great. Okay.
Let me verify, Mike. I will verify that it was 4. Maybe if one of my staff could text Rachel to verify it was 4, we'll verify it before this is over. But I believe it was 4.
Commissioner, this is Al Cormier, facilities exec. I can verify that there were 4 individuals on that, 4 staff from TransCore, which is a subsidiary of Core Civic. 2 of those individuals have tested negative. We're still awaiting the results of the other 2, but those were TransCore officials.
So, Mike, that's verified. Thanks, Al.
The size of the bus is able to accommodate 30 inmates, but we only had 6 inmates on that transport. So it was 6
Right.
inmates and four staff from TransCore on that 30 passenger bus.
Great. Thank you very much. Appreciate it. And Rachel.
You're welcome, Mike.
Thank you, Mike, and thank you, Al. Okay, next we have Kevin from 7 Days.
Hi, Kevin.
Hi, Jim. Can you hear me?
I can hear you, Kevin. Good afternoon.
Good afternoon. Thanks for making this press conference available. Can I ask you a little bit about the department's response? Sorry for that echo. Do you hear that?
I can't hear it, Kevin, but I can hear you.
Okay. I'd like to ask you about the injunction request and the department's response to the injunction request in the Brian Butler case from April. In that,
You know, Kevin, you're breaking up and it's echoing and I cannot make you out now.
how about now?
It's a little better, yes.
That's better now for me too. So my question is, the department responded to that request or to that injunction request in part by noting that a Department of Corrections official named Richard Byrne was in daily phone conversation with the warden at that facility, and that
Yes.
the substance, quote, the substance of these phone calls is immediately reported to the Vermont Department of Corrections leadership team. Does that sound accurate to you?
I didn't get what you're leading. Are you talking about a pending lawsuit?
No, I'm talking about a response to an injunction request. And this organization wanted some hand sanitizer and mask wearing.
Kevin, I'm not trying to be difficult, Kevin, but you're echoing pretty bad. It's hard to figure. I know I got injunction, but I'm not getting the rest of it.
Okay, how about
I'm just going to quickly ask that everybody who is not Kevin and not the commissioner, please mute yourselves right now.
Did that help? Did that help?
That did help, Kevin.
Great. I don't think it's me.
No, I think when folks are not muted, you'll get that echoing sometimes.
Yeah. I think I can cut to the chase.
Yep.
In the injunction request, in the department's response to this injunction, you said, your attorney said that Richard Byrne was in daily contact with the warden at that facility, and that the substance of these phone calls is immediately reported to the Vermont DOC leadership team. Does that sound right to you?
Well, let me answer that in general terms. Rick Byrne would be in contact with the staff on a daily basis in Mississippi, and I, the commissioner, since I've been here in January, was often briefed about what was occurring in Mississippi.
So my question is, was it clear to you that the protocols that were taking place in Mississippi were at a less robust level than what had been implemented in Vermont?
What I knew and what I was briefed on is that Core Civic was following CDC guidelines for facilities such as jails. Now let me at my end, Kevin, cut to the chase. In hindsight, as the Commissioner of Corrections on this particular issue, I should have been more inquisitive, and I should have been more aware of processes in Mississippi and asked more questions to clarify that. Because clearly where we sit now with the number of positive tests, something went wrong. And I don't know what that is yet, but no matter what it is or how it is, Jim Baker is the Commissioner of Corrections, and he's responsible for it.
Okay, the last question I have is, there's another line in there that indicates that the TCCF, the facility, has taken ample and appropriate steps to reduce COVID-19 exposure and infection for the inmate population and staff. That's the state of Vermont saying to a prisoner, essentially, down there, don't worry, the facility you're in Mississippi has taken ample and appropriate steps to reduce the exposure. That seems maybe not to be where you're presently coming from. Is that fair?
That's fair, Kevin. And again, at the time, we thought that was occurring, and I'm still not in the position to figure out yet why we are where we are. But clearly, we didn't get to where we are if the best practices that we practice here in Vermont, and we have one of the lowest spread rates in the country for state jail systems, clearly we're not being followed there. And I'm not happy about it. And we need to figure out why that is.
Okay, and last question is, can you just give me a little more sense of what some of those plan Bs are that you say in an emergency case you may need to implement some of these other things? Does one of those include bringing inmates back to Vermont?
It could be, Kevin. We've got to make sure that we've been working diligently over the last several days, verifying the medical care, the medical surge capability in the area. That's part of what our medical director will be doing when they get on the ground tomorrow. And once we have that, we'll have to make some decisions. I know in my last press conference on Monday, it was reported potentially that I was saying we'll bring people back. It's not what I'm saying. What I'm saying is we have to figure out what's going on, take a look at the individuals, their vulnerability, and then figure out a plan to keep them as safe as we possibly can. And that may or may not involve bringing folks back.
Okay, thank you. Appreciate it.
Thank you, Kevin. Thank you, Kevin.
All right. Next, we have Beth, Box 44, ABC 22.
Good afternoon, Beth. Is Beth there?
Beth, are you here? If anyone's having difficulty unmuting yourself, I had to mute some people in order to ensure quality of sound. Please feel free to ping, use the chat, send me a text. Beth, are you there? Okay, we'll come back to Beth. Lisa, Associated Press.
Who's this again?
Lisa,
Lisa, how are you?
Associated Press.
Hi, Lisa. I don't know if it's us or them, Rachel.
I'm not sure. I'm looking to figure that out right now. Can people unmute themselves, please? Lisa, are you there? Okay, we'll return to Lisa as well.
Can you hear me?
Oh, yes.
Hi, Lisa.
Lisa, is that
Hi,
you?
Lisa.
Hi, sorry about that. So I'm not clear, is the entire population at the Mississippi prison being tested, or is it just the Vermont inmates?
At this point, it's the Vermont inmates.
Okay.
We are, contractually, we have no direction over the rest of the inmates, but
Right.
we strongly believe that Core Civic should test the whole facility based upon our history of what happens when we test our complete facility. We don't believe that we can get a handle on what's occurring there without a complete test of the facility.
Right, but the other inmates are from other places, and there are different rules for them, correct? So.
Well, I don't know if there's different rules or not, but quite frankly, Lisa, I don't care what the other rules are. As I've expressed to Core Civic in phone calls over the weekend with their executive team, that we have to do everything we can to protect everybody that's there. I don't have an obligation over other states' inmates, but I do over the inmates from Vermont. And in order for us to be sure that we understand how this virus spread, we've got to get a handle on testing the facility.
And so the Vermont inmates are in one section. Do they interact with the rest of the population at all in dining halls or anything like that?
In general, they're in a section by themselves. But as I said earlier, someone from Vermont could have a job or task within the system where they move about the facility. We have directed them to stop.
Time. Okay.
Well, again, as we understand it right now, a part of the reason why we're sending down one of our staff from our operations staff to verify these protocols that we've gone through with them again.
Okay, and then one last question.
Sure.
The 8 who have refused to be tested, are they being medically isolated, or how's that being handled?
So in Vermont, historically, what we've done with refusals, because it's not unusual to get refusals here in Vermont as well,
Right.
especially on this mass testing that we do, where we're at facilities every 6 weeks. So how we treat it here, we treat it as a positive. In this case, those 8 folks are being treated as if they're positive, and most of them were in housing situations where they're isolated anyway, and we have directed Core Civic to treat them as if they were positive.
Okay, thank you.
You're welcome, Lisa.
Thank you. All right, next we have Todd, Caledonian Record.
Good afternoon, Todd.
Todd, will you please unmute yourself? Okay, we will return to Todd as well. Alan, VT Digger.
Good afternoon, Alan.
Good afternoon, Commissioner. You said you've asked Core Civic to test the entire facility. What has been their response?
I believe they wanted to do it. There is a situation in Mississippi, and it plays into protocols prior, where the capacity to test is not as robust as it is here. We learned that lesson at the end of last week. Just getting our inmates tested was not a simple task because of the capacity to collect and test samples. So I believe they want to do that, and we will have a better handle on that once our team gets on the ground tomorrow.
Okay. Prior to the COVID-19 pandemic, how often did DOC staff travel to Mississippi to check out the facility and conditions there?
They were there quite often, as often as once a month. And I would ask facilities exec Cormier to jump in, but I believe I'm accurate when I say on the average of once a month. And we did communicate with them every day as if they were one of our facilities. Al, are you there?
Yes, that is correct. We would send a team of 2 to 3 caseworkers down on at least a monthly basis. Every 3 to 5 weeks in general, we would have a team on the ground down there inside the facility meeting with the inmate population.
And Alan, you're on to something here that when COVID-19 hit and it started showing up with vengeance at the end of March, beginning of April, it limited our ability to get down there.
Have any of the inmates asked to be returned to Vermont?
Not that I'm aware of.
And then last, are the Newport and Marble Valley facilities in lockdown?
I don't believe so, but Al, can you answer that, please?
No, they were initially, upon receipt of those positive inmates, once the contact tracing was done, the full lockdown was lifted, and they remain in a modified lockdown, as we have been with all of our facilities since the onset of the outbreak in Northwest.
One last question. Are the tests being used in Mississippi the same tests that are used here in Vermont?
They're and if I get this wrong, I hope someone corrects me. They are PCR tests. Again, Dr. Levine and I have spoken about this, and we feel fairly confident that it's the proper collection and testing that's being done.
Is it a different test though? Different?
I don't. We had the name of the test that we pass along to the health department to validate that we were doing the right thing with the testing, and the feedback we have, Alan, is that we are. I don't remember the name of the test.
Okay, thank you.
You're welcome.
Thank you. And Ellen, we can follow up with you on that when we have all of the details from Dr. Levine. He is reviewing the test that is used so that we have the full scope of understanding of everything that is involved, as well as any potential rate of error. Next, Ross, WPTZ.
Did you say
Hi
Ross?
there. Yes,
Hi,
hi, Ross here. I'm well.
Hi,
How are
Ross,
you,
how
sir?
are you? Good afternoon.
So my question is, could you please paint a picture for what the status is of those 64 inmates who tested negative? Are they in something that would maybe mirror some kind of lockdown to prevent them from also being exposed in the coming days, or is their day-to-day fairly usual now that the other 147 have been separated?
We know that they are in a separate area. I'm going to let, since facility director, executive Cormier knows this better than I do from a description standpoint, I'm going to let him describe what's happening with those 64 of us. Al, if you would do that, please.
Yes, sir. So those 64 inmates have been placed in a separate unit. There's the building that houses the Vermont inmates is a separate building away from the main core of the Tallahatchie facility. That building has 3 living units, each capable of holding 120 inmates. 2 of the units are housing the positive inmates, and there's 1 unit that is housing the 64 negative inmates at this time. The negative inmates are basically on a quarantine status, with the positive inmates being on an isolation status.
Thank you. My only other question would be, is there steps towards some kind of investigation to figure out where the breakdown in best practices and breakdown in communication between CoreCivic and the state happens to find out what let things clearly escalate so quickly and so drastically?
Well, that's ongoing, Ross. That's part of our dialogue with them, part of the reason to get a team on the ground down there. You know, and I want to mention something else, and it's not part of your question, but part of the question earlier. Why did we wait to get a team down? We're just now getting back the significance of the test within the last couple of days. So that's part of it. But really, when you say investigation, what we're really talking about is a public health investigation review and trying to figure out, tracing back where the spread started. But I have to remind you that the county that the jail sits in has one of the highest spread rates in the country. And so we're trying to figure that out now. It's part of the process to figure out how that spread was able to occur.
Thank you.
You're welcome, Ross.
Thank you, Ross. And I did get a confirmation from Todd from the Caledonian Record that he does not have a question. So we are good on that. Thank you, Todd, for clarifying. Next up, we have Alec from the Burlington Free Press. Alec.
Alec, good afternoon.
Hi. I don't think I have any questions. I'll pass it on. Thank you, though.
Thank you, Alec.
Thank you. Okay, and is anyone from WCAX on the line? I know that Dom has to get a script in by deadline. Didn't know if he subbed someone else in. WCAX? Okay. Hearing none. Emily Corwin, Vermont Public Radio.
Good afternoon,
Hi,
Emily. How
Hi.
are you?
Good, thanks. I am hoping that you can tell me, or rather that you can list any practices that you believed were taking place in Mississippi, which you've since learned were not taking place.
So if I'm following your question, you're asking if I know of any practices that were not going on that I thought was going on.
Correct.
Yeah, I'm not in a position right now to list those. You know, we're still trying to sort out from our interaction with the staff down there, and talking to other folks. And I must say that the Defender General is helping us with this because of their contacts. I've had a conversation with the Defender General. So that's part of the need for us to get eyes on the ground. But I'm not in a position to start listing those off right now, Emily.
How about, are you aware of any practices that you believed were taking place that you have since learned were not, like a yes or no version of the question?
You know, I don't, because I have some suspicions, but I haven't verified them, and I don't want to be put in a position of saying something that I'd have to take back.
Okay.
But what I will say, Emily, is that clearly CoreCivic, they're one of the largest private providers of jail space in the country. We have up to a $10 million a year contract with them. Last year we paid $6.8 million roughly to them, and I cannot overstate how frustrated I am that someone that runs a jail system like that wasn't aware of the things that we were aware of in little old Vermont, that we're able to keep our facilities as clean as they are. And I can assure you that in a couple of weeks, I'll be better off. I'll be in a better position to answer those questions.
I mean, I guess it sounds like you're saying that you're very frustrated that Core Civic wasn't aware of what we were aware of in Vermont. Is there anything other than testing?
Testing, again, we sent a protocol down in April, right after I shouldn't say right after, somewhere around the Northwest outbreak, to give them some guidance. I mean, clearly, you can't have this kind of outbreak, and we're following the best practices that were out there and have evolved over time. We change our protocol sometimes 3 and 4 times a week to meet the latest guidance that's coming out in our conversations. I'll give you one example, because I think I can say this with some authority. I was taken back by the fact that Core Civic had no relationship with the Mississippi Department of Health when I learned that over the weekend. I realize they're not a state agency and we are a state agency, but these are key. When you're dealing with a public health crisis, these are key partners.
Okay, got it. Thank you.
Thank you, Emily.
I have another question, and that is, you've referred to your medical director being involved in managing this crisis. Are you referring to Scott Strenio? And if so, can you describe his exact relationship with your department?
So it is Dr. Scott Strenio. We have recently, he works inside DEVA. He provides services to us on a loan from DEVA, and he is considered, in my mind, our medical director now on our side of the equation, since we took on a new contractor, medical provider, VitalCorp, and he provides clinical oversight from a medical standpoint to the conversations on a daily basis with our population. And he's been very involved since last week in the conversations and guiding us around the medical issues dealing with this situation.
Okay, and that's in addition to all of his prior responsibilities?
We borrow him for a certain amount of days, hours per week away from his other tasks.
Okay. And then can you describe the difference between quarantine and medical isolation in practice on the ground?
Yeah, so a quarantine is someone comes into our facility, they're new to our facility, or they've been out of our facility for a period of time. We put them into quarantine. They could be in with a group of other folks that are waiting for tests to come back. If we have a positive test, then they go into medical isolation, which means we separate them away from other individuals.
Okay. All right, that's all for me. Thank you very much.
Thank you, Emily.
Thank you, Emily. We have a question that came in via email. Matthew Roy, 7 days.
Good afternoon. Commissioner.
Good afternoon, Matthew.
Commissioner, I'm wondering, what can you tell us about, now that there is this situation where 147 Vermont inmates have tested positive. How is Core Civic dealing with staffing this unit? In other words, are guards free to come and go from the facility? Are they working in shifts and heading home? Or is the company making some sort of arrangements for them?
I believe that the corrections officers are working shifts and leaving and coming back to work their shifts.
So they're just going back to their families and then coming back to work. There's no special housing or arrangements being made as was being done by certain companies that run, say, elder care facilities that were hit by COVID.
Yeah, and I would also tell you, Matthew, that we did it here. We spent a lot of resources on housing our staff in motels. Now, with that said, I don't know what the conversation was today. Al, did that come up today in the conversation? I wasn't part of it.
No, we did question them around their concerns with their staff and that county being one of the top 10 counties for spread rate in the nation. They were going to speak with their HR about protocols that they may be able to put into place, but at this time, those staff are entering and exiting the facility at the end of their shift and going home.
And a follow-up to that is question, commissioners, what does that say to you about CoreCivic's judgment?
Well, I'm not there yet to talk about CoreCivic's judgment because I'm trying to gather the facts. But obviously, this came up early on that in most jail situations around the country that I'm familiar with, where there's been this kind of outbreak, you can tie it to community spread. Again, I said this on Monday and I'll say it again. We're pretty proud of what we've done in Vermont, but we didn't do it by ourselves inside corrections. A lot of work has been done in this state. And as you watch the national news, we still tend to be one of the states that are in very good shape. It's because of the collective work of everyone working in the state to try to keep the virus at bay. And part of that is keeping staff and educating our staff. So I am concerned about this point, and it's part of what Dr. Strenio will be looking at when he gets down there tomorrow. And we're going to have to figure out a conversation, but we got to get their staff tested and figure out what their staff test rate is in order for us to have further conversations with them about this point.
Thank you.
You're welcome. Thank you.
All right. That finishes our list. Does anyone else from the press on the line have any questions?
I have one. It's Kevin from 7 Days Again.
Hi, Kevin.
Is that okay?
Oh, absolutely, Kevin. Go ahead.
My question is whether in these conversations with CoreCivic, the cost of the procedures has come up. And if so, what was the tenor of that conversation? Are they saying that's not in the contract, we're not doing that because that's not part of the contract, or you'll have to pay us X amount more? Whose responsibility is it to pay for the heightened level of medical care and procedures that you're asking them to do?
The only time the conversation came up, Kevin, was in a phone call over the weekend with their senior executive staff, myself, and the leadership team of corrections. And it wasn't totally in that context. It was simply to make it very clear that my expectations of them were the same expectations I have of our staff here in Vermont, that we have a statutory and moral obligation to protect the people in our custody. And they need to do everything possible to do that. And we're slowly working through it. I do not believe there's any obligation on the part of the Vermont Department of Corrections and or the taxpayers to bear any other cost, because our contract with them is to provide facilities for inmates and provide medical care.
Does that give you pause that you're dealing with a for-profit institution that you're trying to insist does more expensive levels of medical care, and that profit motive may be part of their resistance to doing so?
So, Kevin, with 147 people testing positive at the facility, everything gives me pause. And that's part of the reason why, it's a fair criticism that we're just sending people tomorrow, but it's part of the reason why the decision was made to get boots on the ground. And I said this on Monday, I believe in an interview, that, you know, the relationship we have with Core Civic is a business deal. They provide a service, we pay them for the service. It's no different if you have a contract with, you know, someone to fix your car. And if they don't fix your car, you don't pay them. And our business deal with Core Civic is no more complicated than that. It's a business deal. But and just like you bringing your car to a dealer for repairs, there's a level of trust that has to be there. And if that trust isn't there, the person responsible to make sure that the contract's being carried out, which is me, it gives me pause if the lack of trust is there. And so we're working on that now. And I know exactly what you're saying. And my expectation is that the things that are causing me to pause are going to be addressed.
I could certainly see a situation where you would ask them to engage in a level of protocol and testing and isolation and quarantine of inmates that made their entire business model and the amount that they were willing to, they'd contractually agreed to be paid for these inmates, it made it untenable for them.
Well, all I can say to that, Kevin, is I'm the one that authorizes the check to be cut for them to be paid.
Right. Understood. Okay. Thanks for your time, sir.
You're welcome. Thank you.
We are close to the end of our call. We have about 3 more minutes. As a reminder to everyone, I am recording this, and we will have this video on our website as soon as possible. It takes a bit of time, as you may have noticed before, but we will have it to you as soon as possible. Are there any other questions?
I have one, Rachel. Alan from Digger.
Yep.
Yes, Alan.
You mentioned that you're the one who signs the checks or cuts the checks.
I don't sign the checks, but I authorize. Obviously, I'm in charge of the finances, right? Right.
Has there been any stoppage or delay in any payments to Core Civic?
Not yet.
Are you contemplating that?
I'm contemplating everything. Again, the question from Kevin Allen was, what gives me pause? 147 inmates positive give me great cause. And so as the Commissioner of Corrections, I take it very seriously that that's my obligation to those families of those loved ones that are down there. So everything is on the table in this relationship, this business relationship that we have with Core Civic.
Commissioner, this is Greg Lamourie from the County Courier. I have a follow-up for you.
Yes, Greg, how are you?
Good. So given that, in your words a minute ago, that they've lost some trust in you, if it were up to you, would the state of Vermont be looking for a different contractor going forward, and once this contract expires for coverage on this?
Look, you know, I'm going to say what I said earlier. It's a business deal between us and them. It's a relationship built on trust. The stuff that's caused me to pause also causes me to question the trust. I am not at the point, and again, this would be a bigger discussion in myself. It would be with Secretary Smith and others. I'm not there yet because we're dealing with what I consider to be a crisis and an emergency, and we're focused on the well-being of the folks down that are tested positive. And if I didn't mention this, the negatives will be tested again within the next 48 hours because that's our protocol. And so, you know, I'll be waiting for those tests to come back, and gathering that kind of information and having a serious conversation with Core Civic once we get through what we need to do right now to keep those inmates healthy in Mississippi.
Thanks.
You're welcome. Rachel, I want to mention to the press that we are internally having a conversation. There is a possibility that we will do another press available tomorrow. Once we gather information from our folks on the ground. Once we gather that, I'd like to be able to share that. If there's information that we gather of significance that we think the media should pass on to the public. So stand by for that. I'm not saying we're going to do it, but we have talked about it, and I won't know until we get our 2 staff members on the ground for an evaluation late tomorrow morning. Rachel, did I miss anything?
No, sir, I believe that you have it. So everyone that's on this call should have received a press release from us in your inbox shortly after the call began. If you didn't get it, please give me a call, a text, an email. We'll make sure it gets to you. The recording of this will be available on the website as soon as possible. And any follow-up questions, pretty sure y'all know how to get me. So thank you so much for joining us, and we will be in touch with any further updates. Thank you all so much for your time.